Thanks for listening to this podcast of Trending with Timmery from the Relevant Radio app. Anything you share in terms of episodes, whether it's texting it to a friend, posting on social media, helps to build up the kingdom for God, to help confront the challenging issues we face as a culture, but with joy, with hope, and with an eternal perspective where our faith collides with everyday life, bringing eternal principles to help us live our life joyfully.
So, what's trending? Bridging your Catholic faith with your everyday life. You're listening to Trending with Timmery on Relevant Radio.
Today's all about fertility, infertility. An interesting study that some may think is new news, but it is hitting everywhere. CNN, Fox News, MSNBC, you name it, this study is making headlines. And it's this: Harvard study confirms link between birth control and breast cancer. Did you hear me? That's right. I told you so. This is one of the moments where I do want to say I told you so, because finally we are seeing everything from the fact that cross-gender, cross-sex hormones is damaging for children's bodies and adults' bodies to, lo and behold, hormonal contraception is damaging for women's bodies and causing cancer. Multiple types of cancer, but in particular, Harvard is saying it's causing breast cancer. We knew this. This is nothing new. However, it's something that we will talk about a little later on Trending. Okay, today's the topic of the day: fertility and infertility, which, by the way, hormonal contraception causes infertility down the road. If you didn't know that, we'll talk about that a little later. Dr. Susan Caldwell is a medical doctor that specializes in women's fertility and infertility. She's a NAPRO physician trained especially to honor a woman's body, honor the Catholic Church's teaching, and find healthy, holistic ways that help in solving the crisis of women's health and often fertility crises. I've shared my story before, how NAPRO physicians have helped me. I've been there. I get this crisis. I know a lot of you are struggling with infertility. It is a cross, like many people cannot fully understand it. And it's understandable when I see people turning toward third-party reproductive technologies, such as in vitro fertilization, intrauterine insemination, artificial insemination, whatever you might call it. But just because we deeply desire children, does that mean that third-party reproductive technologies are, one, good for our bodies, but two, good for our souls? And do they follow what the church teaches? So today we're going to focus in particularly on intrauterine insemination. There are different types. We'll discuss that with my specialist, Dr. Susan Caldwell. Now, Dr. Susan Caldwell has a unique story. She is a faithful Catholic when it comes to what the church teaches with regard to fertility and how to treat fertility honorably, honoring marriage, the sexual act, in a woman's body. But she also has a unique story in that she herself utilized in vitro fertilization in order to have children, but she would never recommend it to anyone. It was damaging for her body, her marriage, and a number of other things. And so she has a very unique perspective as a medical physician specializing in this area and her past personal experience. Dr. Susan Caldwell, welcome back to Trending today.
Hey, Timmery, I'm really excited about this topic. It's so important.
So I want to kick off with answering a question I feel so deeply for people who are struggling with fertility and infertility. It's near and dear to my heart. And Captain Fab on Instagram had written to me, and he said, "My wife and I are close to a year married." Congratulations, by the way. And he said, "We have faced a roadblock when it comes to conceiving. We recently heard your episode with Dr. Caldwell and have made an appointment with a fertility doctor. They've been advised," he says, "to try intrauterine insemination, also known as IUI, but they do not know enough to consider it, or should they consider it, since they do not know what the Catholic Church's stance is." He said, "I would love to hear your thoughts." So, Dr. Caldwell, there's so much to talk about here. First, just honoring that struggle with infertility that so many people are experiencing. And also, just to start, 1 year in, I know a lot of people tend to panic when they get a couple months in or even a year in, thinking they're pregnant, they want to be pregnant, and what's wrong with us? We haven't gotten pregnant yet. So if you could kick off, we'll tie in the morality of it as well as the medical and interpersonal dimension.
Yeah, this is so common, and it's such a beautiful desire. And for this person to write this, and it's just beautiful, right? It's beautiful to get married, and the next step, we desire children, we're coming together, and we find something wrong. So naturally, you might go to a fertility doctor. But I ran into a patient this week who came in who had did the exact same thing, but they had tried for 5 years. Okay.
Mm-hmm.
And what you have to recognize is when you go to a fertility doctor, that doctor, their business is going to be in vitro fertilization. That is what they're in business to do. Okay. They are not in business to fix what's broken. In other words, they're not going to do a very in-depth investigation. So this person's story was she went in, they did, check the tubes, they checked the man's sperm, and then they quickly said, next is IUI, in intrauterine insemination. And she just said she was taken aback. She said, wait a second, you told me my hormones were normal, my tubes were normal, and his sperm were normal. So could you give me some medicine so we could maybe do some natural cycles on our own? The doctor said no. That'll be $1,000 for the intrauterine insemination. But the truth is that intrauterine insemination is an extremely ineffective technology. There's about a 10 to 20% success rate with that, which is probably less than a natural intercourse for a healthy couple. So what we're doing there is we're bypassing. In other words, we haven't found the problem yet. So we're just going to go ahead and go to a very expensive technology that doesn't actually find the problem.
And I mean, if you just think about intrauterine insemination to begin with, it doesn't quite make sense. If you're engaging in intercourse with your
Right.
spouse, why do you
Right.
need this to be injected in order to make this better and
Right.
stronger? Because as we know, sperm is so effective. It is so potent, and
Right.
there's such a high quantity of it that I just don't get why people think that, in particular,
Right.
intrauterine insemination is necessary. And like you said, it's not more successful than basic intercourse, and where you don't
Yeah.
have to engage in anything immoral, and those are some of the immoral elements. Masturbation is used in the process of intrauterine insemination. We could talk about some of, like, more acceptable ways in which you can collect sperm. We can maybe talk about
Mm-hmm.
that a little later, that honors the marital act and doesn't
Mm-hmm.
require masturbation, but it just doesn't make sense. And I think that's the starting point. You shared that this one for 5 years has been struggling. Intrauterine insemination was recommended to her. So how's her story going? Where's she at in her journey, as this is something she's been advised to turn to as well?
Well, I just met her this week, and but after our conversation, so she was going now. We're gonna. She's been told she had PCOS,
Mm.
but there a thorough evaluation of her hormones hadn't been done, and interestingly, she had been put on the pill for 10 years. And so she
Wow.
got off the pill and was trying to get pregnant for 5 years and hasn't been able to get pregnant. But I guarantee you, we are going to find that her reproductive organs, so the glands in her brain, connecting to her ovaries, they are just not communicating. That's what I find. Almost every single time is there is a problem with the ovaries finally making proper hormones, because the brain and the ovaries have been so disconnected for 10 years that what the woman needs, granted, I haven't done all of her workup, but she's going to need someone to, again, I've said this over and over again on the podcast, but to nurture her reproductive
Yeah.
system, to help her body, her brain, and her ovaries work together, because it's like a baton race, a relay race, in order to ovulate and to have a
Mhm.
healthy uterine implantation. And so many things have to happen. We have to be tending to each one of these places, and it involves enormous attention and care, especially to the woman's body.
Absolutely. And I was even just thinking about it's like stoking a fire, right? Like you're there
Yes.
and maybe you've got a little bit of wet wood, or maybe there's some chemical in the wood
Yes.
and you're blowing and you're being delicate not to blow too
Gentle.
hard, not to blow too soft,
Yes.
to make sure that you have the right amount of flame, the right amount of kindling. That's sort of
Yes.
what's happening with women's bodies in general with all the endocrine disruptors that we have. But if you add the fact
Mm-hmm.
that she was on birth control for 10 years, wow, like you said, her body, her brain, her ovaries all need to refunction and talk to one another.
Mm-hmm.
And this is why you and I have talked a lot about how to get pregnant. We have a full episode on how to get pregnant with Dr. Susan Caldwell. So we'll post a link to that in the episode notes, as well as on social media now. And, we will talk about some of this today, but that really goes in depth on this topic. But before we move on with this whole issue of intrauterine insemination, it doesn't make sense. You mentioned earlier that a lot of women are being told to do this as a 10 to 20% success rate. But often they're not being treated for things such as possibly PCOS. Maybe they don't have an actual diagnosis that's been treated. And also, they've maybe been on birth control that's incorrectly impacted the brain and ovary function to allow pregnancy to occur. But you said something really important. And you said that when you go to a fertility doctor, he or she is in the business to do in vitro fertilization and intrauterine insemination as that first step. And so that's what they make money off of. And so we have to recognize that they're not in the business, as you said, Dr. Caldwell, of fixing things. And that's what NAPRO physicians do. They look under every rock trying to figure out what's going on that's impacting your fertility. That's why I want to talk about that a little bit more as well, but throwing in a Catholic perspective on this whole topic as well. So intrauterine insemination is actually referred to, along with in vitro fertilization, as artificial insemination. It's an artificial means of conceiving. And I think it's important that we start with that terminology that the church uses, Dr. Caldwell, because I think it helps us to realize that we're taking something that's such a great gift, a good of human sexuality and intimacy and the love of husband and wife and the desire and the ability to have a child. And then we're bringing other people, we're bringing other means of going there, such as masturbation, harmful harvesting of eggs, all these things that can occur. Now, with intrauterine insemination, it's that first step that some people will engage in that is not as evasive, but when it's done via masturbation, it's morally unacceptable according to the Catholic Church. When it's done outside the act of marriage, it's morally unacceptable. There are two different types of intrauterine insemination. Can you briefly summarize intrauterine insemination, where you have the heterologous version as well as the homologous version?
Yes. So the homologous version would be when a woman accepts the sperm of her husband. And then if it's heterologous, it's when she's using the sperm of a man she's not married to.
Okay, so in both instances, they're being inserted into the fallopian tube by a physician. Like we said,
Okay,
that could... Go ahead.
so yeah, so actually what's happening, okay, so first the man, in some way, whether it's a sperm donor who's already masturbated and saved a specimen, or the husband themselves, maybe they saved a specimen. So there's a specimen that's obtained all pretty much always by masturbation, and then they wash the sperm at the clinic somehow, not, it's very technical, but they do wash it and clean the sperm, and then put it in a different kind of medium, like some kind of solution. Then they put that inside of a tiny plastic tube, kind of like you would put in someone, like an IV tubing, cannula kind of thing, and that they would insert that into the woman's cervix, which is the entryway into her womb. So I believe that it is inserted into the womb. I don't believe they go into the tube, because maybe they do, but I don't know if they're that specific about looking to see which side. Maybe they do. I mean, to be honest, like I've had that procedure before. I don't remember them telling me they put it into the tube directly, but into the womb. And by doing that, I think they're trying to get over the cervical factor. So one of the things we do in NAPRO is we're looking at all the different factors that contribute to healthy pregnancy or getting pregnant, and one of which is the proper, good, healthy cervical mucus that a woman is taught to pay attention to. And when that is unhealthy, we have lots of ways to improve that. And so, since in the artificial reproductive technology industry, they don't pay any attention to the natural realm, they don't even look at the mucus other than by taking, sometimes they'll take a sample after the husband and wife have had intercourse. They'll take a sample of what's like pooled in her vagina, called a postcoital test, and they'll look to see if the sperm are still alive, and they'll look at what's like the with that. But that's not really very common because, again, they're not really looking to optimize the natural approach. It's
Right.
They're trying to, it's a business, to be honest.
Right.
They're trying to help people get pregnant the quickest way possible. So they do it that way. But yeah, it's a really just very the people who tell me they've had it, and again I've had it, it feels very strange,
And
that
it's
you're
evasive.
doing this.
Right?
Yes,
It's evasive.
yes,
And I think this is one of the
yeah.
moments where it's a little difficult within the church, because the church very clearly, when talking about artificial insemination, intrauterine insemination, says an absolute no to a donor contribution when it comes to
Yes.
intrauterine insemination. But there is an area of debate, and this is where it's one of those moments where you go, good Lord, why can't you just, come down with this clear distinction for us that's absolutely certain? But I think this is one of those moments where God's allowing us to say, how can we understand what honors the body and the relationship? And I think you can speak so well to this, because what the church has not done is that it hasn't made an absolute declaration if the sperm is harvested within the context of the marital act, and how that might be done. And you've spoken about this before, would be with a perforated condom, where some sperm is released into the woman in the natural sexual act, but some is also able to be harvested as well and given to the lab. So if that were the way that the sperm were harvested to then be inserted into the woman, that could possibly be acceptable, but the church has never said yes or no on this topic. And yet at the same time, as a medical professional and someone who's been through this, can you speak to how this impacts a woman's body, and where I think we can further discuss, maybe the church still hasn't quite had this full conversation yet with the latest information we have on this topic?
Yeah. I mean, there's so much you could say. And the church really, it's all about the child, right? The child deserves to be the kind of the fruit of a beautiful act of love between the mother and the father, whereby that child is conceived in the loving, warm place of the mother's womb. I mean, that's really what all the teaching boils down to. It's
Right.
not about what the mom wants or the dad wants or what the couple wants or the dreams they have for their children or how many kids they want. As beautiful as all that is, it really boils down to the dignity of the child that deserves. So, and I love that. And I just do. And then once I learned the church's teaching after I went through IUI and IVF, I was just brought to my knees in just gratitude of the why behind the what. The church was trying to protect me and so many other people from hurting ourselves by degrading ourselves with these technologies that just are not in line with our dignity. And it's really doing us a favor by helping us to see, when this pathway was closed, there was God closes a door to something that's really good. It seems like he's saying no to something that we really want. I guarantee you he's providing a much better way. And that's what really, when I saw that what God had kind of done with NAPRO technology and leading Dr. Hilgers to develop it, he wouldn't have had if he had been stuck in the kind of this ideology of contraception, he would not have had the creativity that has led to this beautiful NAPRO technology, which really just uncovers one by one, when I see these women come to me, and one by one, I find these diseases and conditions that are not only roadblocks to pregnancy, but roadblocks to her like living a full life that's healthy. And if so, I took the shortcut that got me a baby or three, but it totally ignored my humanity, my unique and unrepeatable biology that I deserved for some, really because of my dignity and God's desire for me to live a full life, for that to be uncovered in a way that would show what diseases I had that would lead me to health, not just to a shortcut to a pregnancy.
That's Dr. Susan Caldwell here on Trending with Timmery. Dr. Caldwell, you shared your story before, why you had children from IVF and why you wouldn't recommend it to anyone. Can you speak to the medical fallout you experienced from IVF and even the impact on your marriage as well in that entire story of yours?
Wow. Wow. Yeah. I mean, gosh, so much. So, just with the impatience that I had, it's very, I get the writer here, Captain Fab. It's been a year, and seems like an eternity. Well, it isn't an eternity. I know it feels like that, but when you go to one of these clinics, it's they kind of feed. In other words, the virtue of patience is really not what's being nurtured here, right? So they're gonna they just helped me kind of grasp, oh, let's do this and let's do this, and I was buying into it every minute. Yeah, let's do this, it sounds great. And then I got all these shots, and I just followed. I'm such a people pleaser, following doctor's orders. I'm doing everything. Then I find myself with severe abdominal pain right after the egg, the egg embryo, what do they call it when they put the embryos in? Oh my gosh.
Implanting.
When they actually put the embryos back into my womb. So, and I experienced this side effect of IVF, which is called ovarian hyperstimulation. Ended up in the hospital, truly felt like I was going to die. My electrolytes were I remember treating patients with these electrolyte abnormalities in the ICU and feeling like, oh my gosh, I don't know if I can fix this. And here was I now with a potassium of like 2 when it's supposed to be 4, which is very, very terrible. I felt weak. I was vomiting, severe abdominal pain, again, hospitalized on IV drips. And I just thought this really I was just given so much more of this hormone than my body was capable of handling. And because I was pregnant, my ovaries were just in hyperdrive, like making more and more of these hormones, and all this fluid was being dumped into my abdomen. It took me weeks and weeks to recover. Then I was on bed rest the entire pregnancy because of all these, complications, which were just overkill, right? None of this was necessary. If I had been in the hands of someone who could have gently examined what was going on, the real problem is I was on birth control for 10 years and my ovaries didn't really know how to work. And instead of having someone help them work, no one knew how to do that I was aware of. So I was just prey to this technology, and highly abortive, right? We've talked about all the embryos that died, that were created in the lab, that were discarded and died. These are my children, my flesh and blood, right? And then not only that, what it did to our relationship, our marriage, everything was just so separate. He did his part, I did my part. It was just so divided. Everything was divided. It wasn't a unified, beautiful act of love. It was so technical, and it was so divisive, and it was just it was too much. It didn't need to be this way.
Right. Dr. Caldwell, I know it's so hard to walk back through the entire journey. I hear from so many people where they recognize after the fact it turned that child they sought after into a commodity, and it objectified the spouse, reduced the spouse as a means to just get that baby that was so deeply desired. And, we have a lot to say of honoring the limitations of our particular life circumstances and honoring when the church says no, even when we desire something. Just because we desire a child doesn't mean we have a right to a child. And that's what's so frightening about in vitro fertilization and intrauterine insemination, is that it dishonors that boundary that sometimes occurs within a marriage, but also it fails to honor that boundary of how God created and intended human life to enter into this world, and the child's right to both a mother and a father. That's Dr. Susan Caldwell. We'll be right back taking your fertility questions, 888-914-9149, talking about real solutions to fertility.
You're listening to Trending with Timmery, where you can discuss what matters most to you. Join the conversation, 888-914-9149.
So much to talk about today. I do just kind of want to summarize what we've been talking about with intrauterine insemination. Dr. Susan Caldwell's with me. She's a medical physician. She specializes in women's fertility and infertility. She practices naprotechnology, which is a means of treating a woman's body respectfully and with moral principle, and not putting her body or future children at risk. No abortion, no in vitro fertilization, real solutions treating the underlying issues impacting women's fertility. I use naprotechnology. That helped me in having my baby girls, praise the Lord. And I love that it's Catholic guided. It's phenomenal technology. We'll post the links on social media as well as in the episode notes to find a napro physician near you. You can find one closest to you. You can also work with a napro physician via telemedicine as well. We'll post all of these links and resources because they're so desperately needed, and it might not be you. It might not be you today, or it might be someone else tomorrow that you might hear needs this. I knew about this technology my entire life. I never thought I would be the person who needed help with fertility. I also was buying a car a couple years ago, and the woman I met had been struggling with infertility for years, and I just happened to have that piece of information. Hey, I'd love to offer you that piece of information. Here's a website. So have this. Even if it's not you, you never know when you can help someone through. I remember my mom helped my ice skating coach to conceive a baby by giving her information about napro physicians. And the information can be life-saving, changing, and also help in bringing new life into the world. Dr. Caldwell, I just kind of want to summarize the take on intrauterine insemination. And we talked about how it has less than a 10% success rate. We talked about how the fertility clinics are very quick to suggest intrauterine insemination and then IVF because that's what they make money from, not from fixing and treating women's bodies, such as napro technicians like yourself do. But let's just briefly speak to, that timing. So turning to a napro physician is a solution, but also, this young man wrote in, he's 1 year married. So many people, I think, start to fear. I was in that same boat. Okay, it's been 2 months, it's been 6 months, it's been a year. You haven't gotten pregnant yet. When is a good time to start looking for resources such as napro physician? And how do you have that peace in the midst of that wait?
Yeah. Well, the research shows us that a couple with perfect, healthy reproductive systems, so normal fertility, it can take up to 4 to 6 months for a perfectly healthy couple to conceive. So, these days we have so many great methods of charting for a woman to know when she's ovulating. I think if any couple is sincere in their desire to become parents, they should, maybe chart and with some sort of method, even learning online, whatever's available. If it's been 6 months and
to be clear, sorry to interrupt you, but 6
Yeah.
months of intentionally knowing you're doing the
Yes.
correct timing of trying to have a baby when a woman's actually
Exactly.
fertile, not just randomly.
Yes, that's a great point. So, a woman's egg only lives 12 to 24 hours per month. Okay. And so if she does not have enough mucus to allow the sperm to kind of hang out near where the egg will make its entrance, right? In either side, in either tube. If there's not enough mucus for the sperm to kind of hang out in, if there's not, all these, but you can imagine it's a very small window of time where this egg can be fertilized. 12 to 24 hours is as long as it can be. So the timing is incredibly important. So yes, if she has, decent mucus, she knows she's ovulating and there's sperm, present, maybe having intercourse, maybe every other day, every 2 to 3 days, and there's not a pregnancy after 4 to 6 months, it's time to see someone, not a fertility clinic, right? Because remember, we learned that they're in the business of getting people pregnant quick, 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 right? They're not in the business of figuring out what's wrong. So it might be time at that point, to be honest, I would recommend finding a charting teacher that maybe with a Creighton model would be a great charting teacher. But there are other methods out there that you could learn, like get some expert opinion. And I would recommend a charting teacher, not so much. Maybe you could see your OB and let them know, hey, we're starting to look at things. But you really want to use some sort of a method. There's the Marquette
Right.
method, something to where you're documenting, am I ovulating? Now there's even this company called Prove, Proov, that they have these ways of knowing, and there's Ava bracelets, and there's all kinds of ways, technologies. But the more help you get from an educated person, and to be honest, I don't even think I could count an OB as an educate. I just hate to say
Right,
that,
right,
but
right.
they're just not. They just don't. They've not been taught how to understand how to properly identify ovulation.
Right. And
So
there's so
that's
many
really sad.
doctors. Yeah. And there's so
Yeah.
many physicians I respect who actually know things about fertility, who I share with them about NAPR technology and fertility tracking, and they have no knowledge of it. I'm sharing with them, and I
Right.
buy a book for them, or I send them a link and I say, here, read this,
Good.
please. Like, just so this is a really interesting field of medicine. I know you care about women and fertility, so I hope you'll check it out. And a lot of them have been very intrigued because it's an area of science they don't know about, because it was Catholics who responded to Pope Paul VI, St. Pope Paul VI's call to have respectful ways of addressing fertility. And that was the call. And the answer came from Dr. Hilders, a faithful Catholic who has helped in discovering and creating this medical technology that is almost this like Catholic secret that people are converting to Catholicism because they're going to these doctors. So we'll post a link on social media
Yeah.
in the episode notes to find a physician who practices NAPR technology, and for you to find a fertility care practitioner to help you go through that journey of tracking, because it's so important. Now, I'll just share briefly. I've shared my story before. I'll have to post a link to my story as well. But when we finally, it was over a year before we were ever able to conceive. It was about 6 months in when my husband said, hey, I think you need to, see a doctor and check and see what's going on. I had Hashimoto's disease, polycystic ovarian syndrome. It was 9 months of charting and 6 months of really being intentional and within a healthy context of trying to conceive a baby, that things started to happen, and we have our little girl now. And I think that that's important, that we recognize patience. I was never impatient. I was always really peaceful. And I know stress has a big role to play. We've done a whole episode on how to get pregnant. We'll post a link to that because I think everyone struggling should listen. But I really, Dr. Caldwell, I think over and over again about this. The biblical narrative, salvation history, is full of mysterious, miraculous pregnancies where God is blessed and ordained, not in our timing, but in his timing, the gift of human life, and sometimes not in the ways that we always expect. And so I really hope you'll keep that in prayer and be patient and just turn to our NAPRO physicians and share this with a friend. Dr. Caldwell, so many questions are coming in. If you have a question about fertility and infertility, numbers 1-888-914-9149. You're listening to Trending with Timmery. Dr. Caldwell, okay. Here's a question from Magdalena that came in on Instagram. She said, how old is too old to have children? My husband and I have been open to life for the last 10 years, but it just hasn't happened. I'm now 49 and my periods are irregular, and sometimes I don't have one for months. I've pretty much given up hope. I haven't really reached out to get help because I keep getting told that my baby would not be healthy due to my age. Thanks for your input. Dr. Caldwell, can you share some thoughts here?
Yeah, yeah. So definitely this would be a good time to start charting for sure, because you want to see, it's infrequent at 49 with regular periods. It's going to be infrequent that you would ovulate. But by charting, you would be able to actually optimize. Remember, we talked about just a few moments ago, lining up all of those things. There may still be an occasional healthy ovulation that occurs even at 49. So you want to make sure that you have optimal mucus, of course, you're having, sperm is being, you're having intercourse during the time, so the sperm is meeting the egg, but that there are ways to tell on the chart whether or not there's evidence of ovulation, and you can just with full, full peace, right? Just knowing those things, understanding how your bodies work, coming together, praying that the Holy Spirit would bless your union in that way, if it be God's will. And that way you're doing everything possible. And then if your charting teacher tells you, hey, it looks like, this isn't happening right, or, your doctor might get some labs, they can give you some information. But even, patients that I have in their late 40s, I'm never going to tell someone, hey, it's impossible, as long as you're still having periods, because it's possible that, again, you could be ovulating here and there. So you want to make sure you understand all the timing so that you can do everything you can do to be ready for God's gift of blessing, if that should be the case.
And that's the hard part, is being open. Lord, you may have ordained that I only have one child. You may have ordained that I have two children. You may have ordained that you allow the suffering, that I have no children, whatever that may be. I know that I really, when I got married, especially when I go to receive communion, I'd walk up to the altar, and I'd always try to remind myself, my body, my soul, everything is my Lord and my God's. And that includes my uterus, my reproductive system. Like, Lord, I consecrate this to you. I entrust myself to you. And I think making that prayer and receiving our Lord Jesus Christ in Holy Communion is so powerful, because we are truly conforming ourselves to whatever God may offer us, the joys, and when he allows that suffering for us to unite with him, and also allowing for spiritual motherhood and fatherhood to occur in different ways as well. Okay, more questions. And by the way, I just talked to someone the other day. She said she had a child when she was 49 years old, and that child's 18 now. So,
Yes.
not saying, like you said, you're not guaranteeing that they will have a child, but if they're still having a period, there is possibility and there is hope there. So seize the day, right? The timing is now, if that is your story. Okay, another question. I know we've been talking about this, but Natalie on Instagram asked, are there safe alternatives to in vitro fertilization? I know we say that's NAPRO technology. That's why I'm talking to you. Where does someone get started if they want to start seeing a NAPRO technician?
Oh, that's okay. So yeah, you're going to post the links, right? Yeah.
There we go.
Yeah. So, I mean, obviously, so when I see plenty of patients just off the street, they've heard, what we do, and they come in and they haven't charted, but it could be like, for me, my first available patient my first next available appointment might be like 5 or 6 weeks away. So what I tell people in that time is you could start charting with Creighton right away. You could find a charting teacher. I'm sure you'll post the links.
Yep.
Yeah, and really, IVF is just not. It's almost never really necessary. If you're actually even if we even just took out all the church teachings, right, and just said who actually needs IVF, it would really only be for someone who didn't have tubes. I mean, it's very rare to really need IVF. And of course, now we're coming up with all kinds of crazy ways to make a baby. And that's we're not even going there. But
No, not today.
no. We're not taking on that. But, really IVF is not, it should be rare, if it at all. And it's not necessary. It's not.
And the
it's
church,
over,
even in those instances where, let's say, someone does not have the right reproductive organs to make this happen, the church says no. The church says the child has a right to their biological mother and father. Even international law, the UN still upholds this, even if they don't always uphold what they preach. A child has a natural right to a mother and a father. Just because you desire a child, that doesn't give you a right to a child. When a child does not have access to their biological mother and father, that can hinder the maturing of his or her personal identity, the Catholic Church teaches. And that's different from adoption, because we're talking about creating human life, automatically assuming in the case of a donor that child will not have any access to one of their biological parents, aka donors, in this language. And the church says no, because children have a right to be conceived via the loving and sacrificial marital embrace of husband and wife. And in vitro fertilization almost always includes abortion and always does indeed include the negligence with regard to how human life is treated and experimented on and used to try and achieve a pregnancy, but actually human life dies through the negligence in that attempt to create human life outside of the God-given and God-ordained means. Dr. Caldwell, thank you so much for joining us. We'll post a link to Dr. Susan Caldwell on social media. It's drsusancaldwell.com. That's Dr. Susan Caldwell. Find a link in the episode notes. I've also tagged her on social media. I'll be right back to talk about the Harvard study that confirmed the link between birth control and breast cancer. We knew it, but here it is again.
You're listening to Trending with Timmery, where you can discuss what matters most to you. Join the conversation, 888-914-9149.
So Oxford confirmed the link between birth control and breast cancer. That's right. Birth control can cause breast cancer. So can abortion, but we're not talking about that today. So Oxford has confirmed the link between birth control and breast cancer, and this has hit the mainstream media. I mean, CNN, MSNBC, everyone's talking about it, but what's fascinating to me, even the Oxford Mail, their own website, chooses to quote not one of the study researchers. No, they choose to quote some female feminist professor who says, yeah, we've already known that birth control can lead potentially to some risk of cancer. But women already knew this. And women were already willing to take the risk, so women are just fine, and we really don't need to talk about this. Are you kidding me? Oxford University is saying that get this. Where's my paper? 25, no matter what kind of hormonal birth control you take, there's at least a 25% increased risk that you will contract breast cancer. Did you hear me? 25%. Now, no one's talking about the science and data behind this and the fact that if you already have a propensity, a risk, a genetic risk toward any type of cancer, it's like a death sentence for some women. It is an absolute diagnosis of cancer down the road because you are nuking your body with synthetic estrogen and progesterone that are known, absolutely known, to be cancer-causing carcinogenic drugs. Let me just run down a little list here because I think it's important that we do for just a moment. The dirty little secret is this. The pill is a cancer-causing carcinogenic, and it's recognized even by the United Nations. Here are just a handful of studies, and these have been out for many years, decades. Cancer research in the UK says breast cancer is more common among women who take hormone replacement therapy. In other words, women who are taking cross-sex hormones, who are identifying as transgender, and men. Yeah, them, and the pill for long periods. That's a cancer research center in the UK. Time Health and Family released a study titled A Curious Link Between Birth Control Pills and Prostate Cancer. Why? We'll talk about that in a moment. Prostate cancer, yes, caused by women taking birth control because it's in our water supply. I'll talk about that in a moment. The Journal of the National Cancer Institute said oral contraceptive use has been associated with an increase in the risk of breast cancer in young women. The following information now comes from the Breast Cancer Prevention Institute. The Breast Cancer Prevention Institute says that many new drugs devised to prevent or treat breast cancer actually act by blocking estrogen receptor sites in breast cells or cause our bodies to produce less estrogen. Because here's the thing, synthetic estrogen causes cancer. So here's how hormonal birth control, any type of hormonal birth control, can increase your risk of breast cancer and other types, but we're talking specifically about breast cancer today. Number one, it puts the body in a state of pseudo-pregnancy. When you are pregnant, what happens? Women's breasts often get larger. This is why some girls, I've known girls to do this, take birth control sometimes. They want bigger boobs, okay? So here's what happens. It puts your body in a state of pseudo-pregnancy. Why does the size of the chest increase? Because science is clear. When you're pregnant, you have an increased number of breast tissue that develop. Now, those breast tissues need to mature to type 3 and 4 lobules. But when they first start to develop in the body, they're type 1 and 2 lobules. This is a type 1 and 2 breast tissue. Type 1 and 2 lobules of tissue are extremely cancer vulnerable. Now, through the course of a pregnancy, a woman's tissue matures to be cancer resistant as it prepares for nursing. But when hormonal contraception enters into the body, number one, those lobules, those breast tissues increase, and they increase with a very rapid number of cancer vulnerable tissue that never mature because the woman's body's pretending to be pregnant but isn't actually. And so those tissues don't mature to be cancer resistant. And there's an even higher quantity of them. That's why abortion causes breast cancer too, because the same thing happens, but the process of the pregnancy stops with the abortion. And so the development of the tissue that is extremely cancer vulnerable stops, leaving women extremely vulnerable to cancer. So that's one reason why women who take hormonal birth control are highly susceptible to breast cancer. But the second reason is for what I just said, that women who take estrogen and progesterone in their synthetic forms, we need to understand that all of these institutions I just mentioned recognize the pill and the various versions of hormonal contraception as cancer-causing agents. Carcinogenics. This is a huge deal. And so the fact that Oxford University is bringing this to the limelight yet again, we've known this for years. But here's the deal. As we saw, there's a political spin on it. And what are people saying suddenly for the first time? Well, we've known this for years. Women knew that there was a risk of breast cancer. No, most women didn't. Most women never read that pamphlet, the insert of their birth control. If you know someone who's thinking about getting on birth control or who has or is, tell them to take out that pamphlet and let's read it together, honey, because you do not realize the damage that is being done to our reproductive organs. Not to mention the fact that there was a JAMA study that came out just about 5 years ago showing a major link and permanent damage being done to the mental health of women who take hormonal birth control, especially between the ages of 15, or should I say earlier, about 12, 13 and 25. Why? Because when you take hormonal birth control, when you nuke your body as a woman with synthetic hormones, your body's natural development of hormones that are still developing, of neuroreceptors and connections between the ovaries and the brain are damaged. And it's causing propensity toward anxiety and depression. And it's also impacting our ability to reason properly. That's right. The brain doesn't fully develop until we're about 25. And that part of the brain that has to do with being reasonable and reasoning things out doesn't fully develop until then. And that part of the brain is being permanently damaged and stymied from developing because of the nuking of our bodies with hormonal contraception. The negative consequences go so much further. Women who are struggling and suffering from infertility, as we talked about earlier, and turning to terrible and damaging third-party reproductive technologies such as intrauterine insemination and IVF. I mean, these things are not helping solve the problem of hormonal birth control that has been damaging our bodies for years, causing infertility, causing blood clotting, hemorrhaging, so many issues for women. So don't let this study go ignored. Talk about the Oxford study and don't accept it when Oxford publishes the study, but then asks one of their feminist professors to talk about it. And she says women have known about this for years and they're willing to take the risk of breast cancer. No, I don't know any woman who actually wants to risk a 25% increase in getting breast cancer. That's an absolute lie. And don't allow so-called feminists, so-called women who are pro-women to speak for you and I. Because it's hurting people we know and love. And the buck's got to stop here. And we have all the data there to respect our bodies when it comes to hormonal birth control. And not to mention the Catholic Church teaches an incredible teaching that every act, every conjugal act between a man and a wife is meant to be unitive and procreative, that it's open to life and it's unitive for the good of the spouses. Whether it's the medical barrier of hormonal contraception or a physical barrier, all of that leads to a deeper barrier within the interaction of marriage. The interpersonal dimension. I've seen women for years. I've worked in the crisis pregnancy centers. I've talked to women who have been there. They can speak in volumes to the damage interpersonally, spiritually, emotionally, and physically that hormonal birth control does to their bodies. Don't let another woman say, I wish I knew, or I didn't know till later, or I did it because everyone says that we're willing to take the risk. Women aren't willing to take the risk if we actually know, and the culture doesn't expect us to. Up next is a family rosary across America. Pray for me. I'm heading on a marriage retreat this weekend. I'm feeling a little tired, but it's worth it. Every time you go to a retreat, there's everything trying to pull you out of going, but it's important that we still go.